All routes led to Umueri Okebo community, Anambra East Local Government area of Anambra State, as important, very important, and really important persons, personalities and functionaries gathered in the ancient Igbo community recently for a signal event. The date was Tuesday, the 27th of June 2023, and the occasion was the flag-off of the 2023 edition of the Maternal, Newborn and Child Health Week. The event took place at the Umueri Civic Center, Ama Umueri, Odabo, Otuocha, Umueri, and witnessed the coming together in one place and at the same time of the executive governor of the state, ably represented in person by the deputy governor, Dr. Gilbert Ibezim, himself a medical doctor, the Honorable Commissioner for Health, Dr. Afam Obidike, the Local Government Transition Committee Chairman for Anambra East Local Government Area, and top officials of the United Nations International Children's Emergency Fund, UNICEF. Also present were officials from the Anambra State Ministry of Health, the Anambra State Primary Healthcare Development Agency, and other top government functionaries in the state. The Maternal, Newborn and Child Health Week is a program of the UNICEF in collaboration with institutional stakeholders in healthcare delivery in Anambra State, with a goal of delivering quality healthcare interventions to vulnerable new mothers, newborn infants and children at the grassroots. The traditional ruler of the host community, His Royal Majesty Ibe Sabeneth Isichukwu Emeka JP Okebo II of Umueri, was on hand to receive his very important guests.
Ona ulani ulogu mwezu kumale mwezu kumale waalibani amma waalibani government Anambra State amma Umueri leaders are very happy with the government. Now Commissioner for Health now to lean on at that hospital. If I be ready by no came the we putala ego anya akwa akakuru gugu nwe na no ya delu mu Anambra dizo we dey kura Anambra East chairman never omelo health center bo PH1 Ghana ya kamelita PH1 Ghana we PHC Otuocha 2 that hospital the under Umueri although that Otuocha was true. But I can't get about Topia in the West Guru area. I got here signboard, they will be Barupia. So the is a good to find the area. They have a letter. Come on, the other way. And also, legal matter. Now, the buyer, they see I can go to that place. I call, I'm not calling the giver. Do a website, they go to me. I'm not going to get an answer. I'm not going to be able to see it. So what is the great pride in your home? The very specific from Otuocha 2. Otuocha was 2 for the year, which is Umueri without the war, all for the year. But if they take over the year, when they are going to be in Anambra, and I like to read more, I'm going to like them to learn. That makes a good something that
Umueri community turned out en masse to welcome their august visitors and benefactors with a performance of cultural dances by the pupils of Otuocha Primary School, Odabo, Otuocha, Umueri. After the welcome dance, the program continued with a speech by the Honorable Commissioner for Health, Dr. Afam Obidike, whose enlightened interest has revived the hitherto moribund Umueri General Hospital and set it on a sure path to a return to its glorious past, when it was the sole provider of quality medical health services to the communities of the entire Anambra region, covering the present Anambra East, Anambra West, Agamelum, and Oyi local government areas.
First, I can now Professor Charles CFR, who is presented by the Deputy Governor, Dr. Onyekachi Ibesi, the medical doctor. Sir, you are very welcome, sir. Then first also the traditional ruler, the Umueri, Igwe that is supporting from the day we started this work, Igwe, and the PG also in us, I was there because I got that today. The PG would hear that one will be discussed. Then the TC, the mayor, thank you so much. And first, to thank the UNICEF members. We want to thank the UNICEF here, the team, all of them that have been supporting the state. Very, very well. And hello, can you hear me? That today, simply the maternal and child, newborn maternal and child healthcare services. The essence of it, we can't, I'm sure that in the primary healthcare must have finished giving us the direction. Why want to go the any kind of better doctor? Because someone ever and now was given out to every year, 2 times, the same one maybe can buy the need is wrong doctor, either a need and wrong war. But first, we want to thank UNICEF specifically for this function, their excellency, because they have been supporting the states actually on health sectors. And even in Anambra today, there were so many towns. When I choose to guide you, Anambra is and they are there again. Then we want to say what I say now the guy get Umueri now what I'm this now it is our time for the program to come too. And while I remember one thing when we were coming here, Mr. Deputy Governor, if you remember, ever guide where we engine, okay? Now they are going to work. So that memory came back to me, sincerely. And as it came back to me, it's also came back to that UNICEF supported us on that project. Purely, what you mean by flooding disease? Over time, this place is flooded. Those people you see that they were displaced. With the help of the governor, deputy governor who champions the flooding system, we were able to take all of them and end the clinic. We have an IDP camp. Do you know what we found out in IDP camp? Pregnant women that were there, almost 95% of them were anemic. They were anemic. So that is one of the reasons why we are here. And we found that they were not coming for antenatal. So that also influenced the choice for choosing this particular area. So what we're saying our women is this: we have our primary health care that are very functional. And the governor is actually very soon. You see some things we are going to do in the primary health care area. The ones we mentioned and asked that we're going to look into it in detail. Then the general hospital don't know where it is. Yesterday I was discussing with them with this program. We're going to get a pediatrician that will be coming here to consult. That's the thing. The doctors don't only be from that place. We put almost 4 medical doctors there. But when I went there 2 days last week, I found out that there's something missing. We need a pediatrician consultant that will be going there to consult at least once in a week, at least on Fridays. So yeah, I'm going about that. Anyway, doctor, now 4 months, we are there. Just all down here, all government I put a start to come and so those guys get put so so that they got that. So now come on, so it is very, very essential. The drugs, the week we are going to march for this week is very essential. It's very remarkable. it looks simple and something this, but it's very essential. It's life-saving. It's very life-saving. So I'm happy the TC chairman is here, sir. The mayor and also other mayors in other local government are also keying into this program. I saw the deputy, sir. If you hear, I'm wearing the deputy store. They are also flagging this thing off in their own area, the local governments. So we are having multiple functions in the 21 local government. So please, after today, let it not be a flag. You know, the governor doesn't believe in showmanship activities. The places, please, we are asking you to monitor the activities in the local government, in the villages, to ensure that it produces effect. So at the end of the day, please, UNICEF, I can't thank you enough, man. We want to thank you. Thank you so much. Thank you. I was happy to see you paying this morning, and then thank you so much. And our sister from India and other things, please. Thank you so much. We will continue to work together on this. We are ensuring you that the ones expected of the government, the deputy governor is here, and our governor is always ever ready to play his part in all those things. Thank you, sir. So you don't need any man. So you don't need any man. Oh, yeah, Jimenez, and I'm not putting I am. Oh, yeah, Jimenez, and I'm not putting
The Deputy Governor of Anambra State, Dr. Gilbert Onyekachukwu Ibezim, representing His Excellency Professor Charles Chukwumasuludu, the Executive Governor of Anambra State of Nigeria, spoke to the people of the importance of an all-hands-on-deck approach to public and personal health. He emphasized the need for personal hygiene, environmental sanitation, proper nutrition, and of the superiority of prevention rather than cure as a strategy for ensuring personal, family, and public health.
I will have a mix, just a few minutes, English and the language we communicate. If I galeba, oku arike. Ndị na-enyere anyị aka unu cheta mgbe onye isi anyị bụ Prọfesọ Chukwumacha Soludo mgbe ọ bịara kampen ọ dị ụzọ ife one na one ọ kwere anyị na nkwa ọ kwere na a ga-alụ ọrụ ọ kwere nkwa na ya ga-enyere aka weta arụ ike ụmụ akwụkwọ eje akwụkwọ edozi obodo achụpụla anyị ndị ori ọlụ a ka anyị nọ onye maka o ji abụ anyị kpọọ ụdị okwu a ebe ọ bụla etinyere ya anyị na-akaba arụ jefu imezu nkwa ekwe nke anyị nọ na ya tata bụ maka arụ ike ndị nne ụmụaka ụmụobele ụmụaka ekucha n'aka nri a na-eli enwe ike ebijuo akpụ ebejuo ya afele were ofe nsala wee na-enogagi ya ihe ama na nri ya ezuru oke ịfụ nwatakịrị na-ene ofe nri akpụrụ etu a ma arụ adịghị ya mma o nwere ụmụ obele ife dịcha na nri ezuru ezu n'ime ya ndị oyibo na-akpọ ya supplement ọ ya nwa ka ndị abịa ka fanyere anyị aka ka ụmụaka amụpụta ọtọ echi gụọ akwụkwọ ọ na fama mbụ gọvanọ ụlọ asasịrọkwa nke a ike ọ bụrụ na ndị Umueri achọrọ ịbụ gọvanọ ndị mba ukwu chọrọ ịbụ ọdụmụ na agha agba ọsọ ndị spọts onwe mgbe a na-anụ maka egbunike fa ma ndị amamikele obifa onye arụ siri ike uche zuru oke na-eme ụmụ ife a wee zụọ nne ya wee zụkwuo n'obodo ọ bụ eziokwu ọnya maka anyị na-eme taa so na ife anyị na-eme taa dị bido wiiki a ọ bụrụ emesịa ya si na ama mmezi na-eme ya wee na-echeta na mee ka esi eme ya a na-akụzi ụmụ ife ụmụaka ọgwụ mgbochi ọrịa niile bụ ụmụ ife a na-etinyezi ọ na-egbu egbu ọ ife eji azọ ndụ ụnọdụrụ ife na-ekwu onye tinyere ya n'ọnụ ọ lachaa ya ọfụma n'ọka iwee too ka iwee dịka anyị ọnụ ụlọ ama nchọ ka unu too ka unu dịka prọfesọ Soludo ụlọ ahịa chọ ọ maka na arụsiri ike ọmala onwe so igwe anyị ji wee nọrọ ebe a maka onwero ife ọbụla anyị ga-eme anyị kobie n'elu ọmanwụ isi okwu kịta kwuo maka ụlọ ọgwụ mana ofe ife ka m nwere igwe anyị ga-enebanye anya mana onye si na ya ma nlụzi ụlọ ọgwụ ya ma ntinye ego maka na ya mara ndị nwe ya echekwa m na ọ chọrọ itinye ego maka na arụ adịrị anyị ọnwụ abịa ọnwụ ọmala onye Umueri ọnwụ ọmala onye Aguleri ọnwụ ọmala onye Otuocha ọnwụ ọmala onye Isuọfịa ọnwụ ọmala onye mba ugwu ifugo na anyị nwere ofe ife so na ịmara ebe ụlọ ọgwụ dị maka o metụrụ ọnụ o metụ imi o nwere ike na asị na ụlọ ọgwụ a bụ nke ndị ọzọ na ama ntinye ego mgbe a ga-eji wee gbalị wee jebuche gị ebe a ọ mgbe ị ga-adị unconscious yọtife na-ekwu so onye fọlụ ebe ọ dị ya jee lụọ ya anyị niile nke anyị ama mkwetezi bụ ikekwe anyị lụchazie ya ndị na-aza aza asị mba ndị obodo ọzọ abịa na nọọsụ fanwere ebe a ọmankwa anyị as a government and I know Mr. Governor ọma nkwado ụdị ya so n'ebe ọ bụla anyị tinyere arụ ike Commissioner for Health n'ebe a ife mụ na ya na-akpa kịta bụ the General Hospitals Governor tinyechagoro ego na etu e ga-esi ụsọpụchi ọsịsọ nye ma ndị doctors nye ma ndị nurses health workers anya na-akpọta ma ndị UNICEF a ma ife niile a na-enyere anyị aka na-etinye ọgwụ n'ime ebe onye si na oje were ife dị n'ụlọ ọgwụ a were okwu arụike n'ụlọ ọgwụ bụ akịdị ọbụrụ mana akịdị ada ama ọka akịdị ọ na-ama ọka akịdị ngwọkọ ọgba nke a na-eto eto ị nwere ike ịkọ ọnya n'ugbo gị ọ bụrụ na ị bịara neti ya o tolu ọ banye n'ugbo nke onye ọzọ wee jee na amịlị ya onye ahụ bịa ọ kpachara ya ka akịdị dị n'ugbo ya ọ bụ eziokwu na be anyị na-enwe ukwu ụdala enwe igwe a na-enwe ukwu ụdala ọrụ ụdala da na anị onye ma ọ bụgoro onye isi ọzọta ya n'ọkụ ọtụtụ ya etu a ka arụ ike so unu ga-akwado ife ọbụla gọọmenti ma the UNICEF all of them support that they are supporting us in this program fa weta anyị nwa weta arụ ike wee zuo anyị niile ozi anyị bịara izu unu tata na pila nke arụ ike gọvanọ kwadoro onye nwa ka anyị ji bịa nwabele oge anyị ga-flag ya off unu eje kpọba ndị ọzọ ebe onye ọbụla nọ ife abụrụ ụmụaka niile ama m na Umueri dị more populated than this the whole of Anambra East West unu ewele ozi ọma ndị ife anyị bịara ebe a abụrụ nọọsụ unu anyị na-ewebata unu dịka ụmụazị ọbụna-abịa ọbịa ndị solu Jesu Kristi mgbe ọrịa ụmụazị Jizọs ọrịa so unu abụgolu ụmụazị ndị ọrụ arụ ike onye nụ ojebe gịnị ọkaala ibi ya ọ nwekwara ife ọzọ dị mkpa and I must say this iji na-abịa ụnanụlụ ife na-ekwu anyị na-edozigasịcha kịta ebe unu ga-agbaje ma iji abịa Commissioner for the Transition Committee Chairman ọ nọ ebe a oge luo ọ ga-agwa unu na ebe unu ga-eje na ebe unu ga-eje unu ekwekwana ka iji gbachibido unu maọbụ isi na-ekwe olicha ụkwụmome nke ọgwụ onye dị ndụ ga-eli nri ọrụ eziokwu unu apụtagodu gọọmenti enyela unu aka mgbe afọ anyị na even the UNICEF anyị na-afa na-agbakọ for the flood ọnwa ife ubi unu ga-ewele na unu ebido n'oge welu bịa nwayọọ maka na a sị na eme ngwa ngwa eme gịnị emeghela ọdachi. Ana m ekele unu na anụ m na otego unu na ya onye nnu omegịnị ọkala ibie okwu adịka ibe ụmụaka daalụ. Ọnwa ife ubi unu ga-ewele na unu ebido n'oge welu bịa nwayọọ maka na a sị na eme ngwa ngwa eme gịnị emeghela ọdachi. Ana m ekele unu na anụ m na otego unu na ya onye nnu omegịnị ọkala ibie okwu adịka ibe ụmụaka daalụ.
UNICEF na Arika una ifeni na akọrọ na program a na-eweta iji wee kwado ife gọvanọ anyị na-abịa. Anyị wee na-ekwusi na solution is nutrition.
Without wasting your time, permit me to call on this woman, the Deputy Secretary, Anambra State very beautiful, very intelligent, very articulate. Now, come to the line.
Excuse my voice. I've been using this voice to sing praises to God. Even only yesterday, I celebrated my 100 days office.
Wow! 100 days!
Like I said, I've been singing praises to God for the opportunity. Not everyone at this stage will have the opportunity of being ESCO. So, for me, it's something to thank the Lord for. And I'll be thanking the Lord for that. Also, putting in this one, like it's 1 second. For the opportunity. So we let him not take again. You can help me in your own way. You might just thank the Lord for the life you have given to me. It is indeed a good God, yes. Thank you very much. And on this note, I want to thank the Almighty God for the opportunity. Today we are at the palace or community Umueri because His Royal Majesty Igwe Ben Emeka Okebo Umueri has graciously accepted to host the flag off. When I achieve that flag off, just look for a place. Governor Gasti Jeheba. And then, was lost to Jeheba, Igwe see, because my hands are open to receive you. So I want to thank Igwe for this lagis. I take my 100 days in office, and I'm going to flag off a day after. Something I want to take for Chairman, I want to speak to you again. Setting to host us. For how many days I have now? But because you're here, and you wait for Papa, you cannot be the man will be smiling because the warm welcome is so overwhelming. It's so exceptional. Actually, I haven't gone to the flag of this kind of crowd before. Yes. I'm so proud of all of you. This kind of crowd, you can know what to. Madam, I am one way here. Hello, where do we hear ourselves? But don't walk out on some house or from my. Oh, no, what no word. That's no problem. Because your mother was saying, my daughter is getting married soon. Maybe they said, no, I don't want to know. Because I'm so overwhelmed. you, I didn't forget you. Mommy, Dalo, I'm very glad you know the system working. I'm so glad. He will thank you for being gender, friendly. He will talk for one year, but we didn't talk about you as well. I know we will.
Wow.
I'm grateful to you for making me a part of this team. The things they don't go one-sided. This is a balanced team, and I can assure you that this team is so balanced. Well done. They were here on time. They came before some of us, and they had to arrange a hall. For me, I love my heart for you. For time, let me start on protocol established by the chairman. Let me just read my brief remark on this event of the flag off of Optimize MSCH Week. The National Council on Health at the 53rd meeting approved the annual nationwide implementation of MSCH Week as one of the initiatives of the reduction of unacceptably high numbers of illness and death among women, newborn and children in the country. COVID-19 vaccination for adults has been included in the basket of MSCH Week interventions. Therefore, Optimize MSCH Week in Anambra State aims to improve the livelihood as well as reduce mortality and morbidity rates of Anambra citizens. General objective of the week is to strengthen the delivery and utilization of health services using the 600 PHCs, facilities, secondary and tertiary facilities, outreach temporary sites in the state with the following specific objectives. So we have today, and they include number 1, to increase access to and utilization of essential life-saving interventions in folic acid, vitamin C, albendazole, vitamin A, that is just out. In that interventions again, this because I got malaria. I got is exercise treated mosquito nets. I can make sure that so, number 1, I took out increasing access to and utilization of special commodities like I gave you. Number 2, to strengthen routine online system through updated knowledge and skills of health workers for service delivery, improve health management information system. I got data. I got what I don't know. I have a good one already 0 to 5 months in here. I have a good one 5 years and above on the whole land. So data is very important because you cannot play without data. So I got like him. Please look at mother let have to know no. Mother let get the law book. Mother why you want that one isolate the folic acid. Me and also teaching. Like I say, whatever you don't document, you didn't do it. Whatever done but not documented was not done. So you get me number 1, you also have to document it. Oh, I didn't make informed decision. We will data. No, Anambra, when they make decision based on real time, not from a few, nothing ever to formulate somewhere. Then we want to improve healthy household practices via healthcare seeking behaviors. I don't go back family planning. But then I took the line of ways open. But I got more on I got Zoom. Malega, which you work and I got for even though we're very fertile, but the man I got I never exclusively. I didn't me. All the young one exclusively for 6 months. He has now work and very intelligent, like don't work and I'm not one thing now. How do you know what I'm getting? Exclusive breastfeeding. That's why they're very smart and very intelligent. And these things are ingenious. To ensure every child and pregnant mother is reached with high impact intervention, health workers We'll be working at the different PHCs across the state. We have over 600 health facilities. So this program is going to happen in over 600 facilities in Anambra State. From today, after they're off, any health center, you're going to get all the interventions. They are free of charge. They are very accessible to everyone, both indigene and they are so we're not excluding the Anambra or so we are entitled to all these free services. I get that this week. Easy. I may have an old vitamin A supplementation and then I can scream. Oh, I can show how they malnourished. I get where can the level of and that has to be healthy, food-wise. Excuse my voice. I've been using this voice to sing praises to God. Even only yesterday, I celebrated my 100 days office. Wow! 100 days! It's a time of refreshing for me. Like I said, I've been singing praises to God for the opportunity. Not everyone at this stage will have the opportunity of being CEO. So for me, it's something to thank the Lord for. And I'll be thanking the Lord for that. Also, putting in this recognition like a long servant for the opportunity. So we let him not take again. You can have it in your own way. Just thank the Lord for the life you have given to me. It is indeed a good Lord, yes. Thank you very much. And on this note, I want to thank the Almighty God for the opportunity. Today we are at the palace or community Umueri because His Royal Majesty Igwe Ben Emeka Okebo Umueri has graciously accepted to host the flag off. When I achieve the flag off, just look for a place. Governor Gasi Jeba. And then, as far as Jeba, Igwe see, because my hands are open to receive you. So I want to thank Igwe for this lagis. I take my 100 days in office and I'm going to flag up a day after. It's something I want to take for granted. Chairman, I want to speak to you again. Accepting to host us. For how many days I have been now? But because you're here, and Igwe Papa Man, before not you now, we'll be smiling because the warm welcome is so overwhelming. It's so exceptional. Actually, I haven't gone to the flag off this kind of crowd before. Yes. I'm so proud of all of you. This kind of crowd, you can know what's Madam, I am one way here, hello, what do we hear? I don't want to own some house or from my oh, no, what no, that's no problem now. Because your mother was saying, I guess I'm getting worried soon. Maybe they said, no, I don't know. I'm so overwhelmed. The candidates will be obey you. 1 week, I'm very glad you know the system working. I'm so glad. Thank you for being gender. I'm friendly. You know, as well. Wow. I'm grateful to you for making me a part of this team. The things they don't go one-sided. This is a balanced team, and I can assure you that this team is so balanced. Well done. They were here on time. They came before some of us, and they had to arrange a hall. For me, I love my heart for you. Before time, let me start on protocol established by the chairman. Let me just read my brief remark on this event of the flag off of Optimize MSCH Week. The National Council on Health at the 53rd meeting approved the annual nationwide implementation of MSCH Week as one of the initiatives of the reduction of unacceptably high numbers of illness and death among women, newborn and children in the country. COVID-19 vaccination for adults has been included in the basket of MNCH week interventions. Therefore, optimized MNCH week in Anambra State aims to improve the livelihood as well as reduce mortality and morbidity rates of Anambra citizens. General objective of the week is to strengthen the delivery and utilization of health services using the 600 PHCs, facilities, secondary and tertiary facilities, outreach temporary sites in the state with the following specific objectives. So we are able today, and they include number 1, to increase access to and utilization of essential life-saving interventions in folic acid, vitamin C, albendazole, vitamin A, that is just out. In that interventions again, please look at because I got one malaria. I got to state is exercise treated mosquito nets. I can make sure that so, number 1, I took out increase access to and utilization of special commodities like I gave you. Number 2, to strengthen routine online system through updated knowledge and skills of health workers for service delivery, improve the health management information system. I got data. I got what you know. I have a book already 0 to 5 months in here. I have a book 5 years and above on the whole lot. So data is very important because you cannot play without data. So I got like him. Please look at mother let have to know mother let get the law book. Mother why you will let one isolate the folic acid. Me and also teach. Like I say, whatever you don't document, you didn't do it. Whatever done but not documented was not done. So you get me at number 1, you also have to document it. Oh, I didn't when you make informed decision, we will data. No, Anambra, when they make decision based on real time, in one point of view, nothing ever to formulate somewhere. Then in Keto, we want to improve healthy household practices via healthcare seeking behaviors. I don't go back family planning. But then I took the line of ways open. But I got more on I got Zoom. I got Uchu Mwaka and I got even though we're very fertile, but the man I got I got I never exclusively. I didn't milk. I didn't milk. Oh, they know they are exclusively for 6 months. He has now work and very intelligent, like don't work and I'm way. I'm not working now. I know what I'm getting. Exclusive breastfeeding. That's why they're very smart and very intelligent. And these things are ingenious. To ensure every child and pregnant mother is reached with high impact intervention. Health workers will be working at the different PHCs across the state. We have over 600 health facilities. So this program is going to happen in over 600 facilities in Anambra State. From today, after they're off, any health center, you're going to get all the interventions. They are free of charge, they are very accessible to everyone, both indigene and they are so we're not excluding the Anambra or the so we you are entitled to all these free services.
Whether we are the government, whether we are traditional leaders, whether we are with development partners, we recognize our duty and our role to our mothers and our children. The week is important because during this week we recognize that mothers need to be supported in their role as mothers and their nutrition upheld. So today we will see that mothers will receive iron and folic acid supplementation. This is very, very important for our mothers. We also recognize the role of children and the importance of their health and our role to look after their health. So today we will see children being supplemented with vitamin A, which, does anyone know what vitamin A does? Yes? I heard yes. Vitamin A. What does vitamin A do for our children? It helps to make children healthy and strong so that they don't fall sick and they are at less risk of dying. So it is very, very important. Children will also receive deworming tablets today, and that is important because it makes the stomach strong so that the food that they eat will be digested well. So I would like to thank all our partners who are here today, and especially our health workers who have gathered all these wonderful mothers and children who will be supplemented with vitamin A, with deworming and iron folic acid. As leaders, whether we are in the government, whether we are traditional leaders, whether we are with development partners, we recognize our duty and our role to our mothers and our children. The week is important because during this week we recognize that mothers need to be supported in their role as mothers and their nutrition upheld. So today we will see that mothers will receive iron and folic acid supplementation. This is very, very important for our mothers. We also recognize the role of children and the importance of their health and our role to look after their health. So today we will see children being supplemented with vitamin A, which, does anyone know what vitamin A does? Yes? I heard yes. Vitamin A. What does vitamin A do for our children? It helps to make children healthy and strong so that they don't fall sick and they are at less risk of dying. So it is very, very important. Children will also receive deworming tablets today, and that is important because it makes the stomach strong so that the food that they eat will be digested well. So I would like to thank all our partners who are here today, and especially our health workers who have gathered all these wonderful mothers and children who will be supplemented with vitamin A, with deworming and iron folic acid. To acknowledge the good work done by the government in making this happen. And I want to say that I know that the slogan of the state is that the solution is here. Yes, so, as UNICEF, we remain committed to supporting the government in delivering solutions. And I hope that the next line that His Excellency the Governor will use is to say that the solution is nutrition. Because without nutrition, we cannot survive. So I hope that you will take the message back to the Governor. The next time I come, we will say the solution is nutrition. So I'm going to ask everyone to say it. The solution is nutrition. The solution is nutrition. The solution is nutrition. And with that, I want to thank everybody for inviting us to be here today. Thank you.